Recently, the Society for Vascular Surgery has decided to sponsor an audiovisual historical archive to feature the outstanding leaders and contributors in vascular surgery. A committee chaired by Jimmy Yao was formed to undertake these interviews. Hopefully, these interviews will help to preserve the impact of our most famous and distinguished colleagues. My name is Roger Gregory, and today I will be interviewing the famous vascular surgeon, Dr. Jimmy Yao. Jimmy, thank you for agreeing to this.
I'm not so sure I'm famous.
Oh, I am. Jimmy, tell us about your early years, your birthplace, and what happened in those early years.
Well, I was born in Canton, right now called Guangzhou, in the south part of China. At the age of 4, Japanese invade China. So my family moved out to Macau. That's where I more or less grew up in Macau. Later on, we moved to Hong Kong. That's the story.
Now tell me about your parents. Your father, in fact, had been a medical student at one time.
He went to Japan. At that time, it's very common people go to Japan to learn medicine. So he wanted to go to medical school in Japan, but after a year or so, he kind of gave up and come back. So he never really finished it. So.
Now, your mother was a large influence on you and your
My mother is from Shanghai. My father is from Canton. Kind of north and south combination. My mother has a lot of influence on me and the children because my father is always busy out of town, not around. So we get a lot of instruction from my mother.
Now, you were one of 6 children, is that right?
Yeah, that's right.
Now, tell me a little bit about your paternal grandfather, the one that had 4 wives.
He is a very successful businessman, not only in making money, very successful with women. They have 4 or 5. I have no idea how many are underground, but he had plenty.
When the Japanese invaded your country, you not only attended high school in Macau, but then the communists took over. So you then had to do what for your education?
Well, when I finished high school, Korean War is going on. China is under communists. I was in Macau, more in the Western culture. So I want to find out how I like it. So I went back to China for a couple of weeks to see how things are. And I don't see, it really is a funny society, so I decided not to go back to China. And so I went to Hong Kong. At that time, my family moved to Hong Kong already, so I went to Hong Kong. So.
Now, college and medical school were combined? Did you accomplish both at the same time?
Well, my education in Macau is all in Chinese system. I cannot get into Hong Kong University for university education because they don't accept Chinese system. So I end up having no place to go to university because University of Hong Kong is an English system. So I end up with nothing. I was doing nothing, but I took some courses in English and just killing some time to learn. And it happened, Taiwan University suddenly want to develop an overseas program to attract overseas Chinese students. So I took the exam and I was lucky, get in the medical school at Taiwan University. That's how I end up in Taiwan University.
In 1961, when you had finished your medical school, you decided that you needed more medical education. Why the United States?
Well, again, I finished in Taiwan. That's a Chinese system. I want to go back to Hong Kong with my family, but Hong Kong is an English system. They don't accept the Chinese system, so I end up with 0 again. They can go back to Hong Kong to work because they don't accept the Chinese system. So I decide might as well get some more training. The place that I look at would be the best for me is Americas.
Wasn't this a huge risk for you to take?
Yes and no, but you know, it's good to get more training. So I decided to go to America, do my internship, and I picked Cook County Hospital.
I might inject here that had it not been for this political turmoil in China, you would never have left.
Yeah, I don't have to, but I don't have any choice.
Right. Now, so now you decided to take surgical training. Why surgery? Why not? Why not
I
medicine?
was in county. I enjoy surgery. It's kind of, you get the instant satisfaction instead of making round every day or all the time and still don't know what's going to happen in medicine. So surgery is always attract to me because it's more or less an instant satisfaction.
But why Cook County?
I look at the hospital is a big hospital, must have a lot of cases. I don't know anybody in Chicago. I never seen the hospital. I look at the brochure they sent out. Sounds good to me. That's it. And I don't know anybody. I never been interviewed, and I apply and I get accepted.
Were you a U.S. citizen then?
No.
Could you drive a car?
When I arrived in Cook County, I don't know how to drive a car. My fellow resident, the American resident, I have to say they are very nice to me. They took me to the parking lot, drive around a couple of times, and when we get down to the expressway where you're merging in, I scared the hell out of them. And I learned, and out a couple of times in the parking lot, I go for the license, I pass.
Now, at this point in time, you were speaking good English, though.
Well, I learned English in school. I won't say I speak very good English. I'm just learning. I can understand, I can write, but speaking English, never really had that before, so it takes time to get used to.
When you finished at Cook County in 1967, you had another important event which occurred in 1967, in that you married a nurse at Cook County.
Yeah.
Now, what was that all about?
Well, falling in love.
Now, by now, would you say, now you've married an American nurse, you've been at Cook County, by now, would you say you'd been assimilated into the American?
Yeah, I would say so. I enjoy the system, and I think America gave me a very good education, a very good opportunity. The people in America are wonderful to me. I mean, they almost like my mentors, all my fellow residents. They are very nice, and we were intern resident all together. We still keep in touch with each other.
You told me that. That's amazing.
After 50 years, we still communicate, and they are very good friends of me.
Amazing. Let's talk about England. You decided that you wanted further training after you completed your general surgery work. Why were you not satisfied with your training in general surgery?
Not that I don't satisfy. I have a very good training at general surgery. But again, I was on exchange visa. I have to get out of the country for 2 years before I can come back.
Okay.
So the only thing I can do is to go to some place 2 years and come back.
Why
I cannot
England?
go back to Hong Kong because
Right.
American qualification doesn't work in Hong Kong because it's an English system.
But why did you choose London? Why England?
Well, it was somewhat lucky. I know a chairman in orthopedic surgery. He's from Scotland. He's the chairman of the orthopedic at Cook County. One day in the stairway, guy talked about thing, and he said, "Where you going?" I told him I'm looking for a place to go. He said, "You know what? I know Professor Irvine at St. Mary Hospital. We were in Scotland together, and I'd be happy to write you a letter so you can find a research position or fellowship in London." So he did write a letter, and I get a letter back, and they took me. So I get a research fellowship at St. Mary Hospital.
So ultimately, you were accepted as a research assistant at St. Mary's,
Yeah.
but why not as a clinical registrar? Why didn't you want to do clinical work?
I want to be a surgeon. I don't want to be just purely research career. So I was again lucky with good relationship with the Professor Irvine, and I was appointed to the lecturer in vascular in surgery, so I can do surgery. And also, the professor recommended to me that I need to do a PhD, so he registered me at University of London for a PhD thesis.
Yeah, St. Mary's also had Charles Robb and Felix Escott. Did you have much contact with them? or-
When I was there, they left already. Escott's still there, but Charlie Robb left. And I was attached to the surgical unit, which is under Professor W.T. Irvine. I know Felix, he's a consultant, so I know him, that's all, but I never worked with him at all. St. Mary is well known for vascular surgery because Charlie Robb and Felix Escott.
Now, about the PhD, tell us more about that. Why were you just spending time or whiling things away, or why did you, and what influenced you to move in the direction that you did regarding your PhD?
Well,
the subject.
when I was in St. Mary Hospital, W.T. Irvine, the professor, established a laboratory, a non-invasive laboratory called blood flow laboratory, using a lot of plethysmograph
Right.
to study blood flow, and I was the research fellow to do all the work.
So you did the test.
I did the test. I learned a lot from a technician called Terry Needham, who taught me really how to do all those tests. And then in 1960s, I can't remember what year, Loren Park, or the Park Electronic Company, come around in London to demonstrate his Doppler.
Yes.
And I saw the instrument and I get interest in it. And you don't feel the pulse, but you still can hear the signal. So with that, you can measure the pressure of the leg. I was interested in measuring blood pressure in the leg, but it's kind of clumsy to use plethysmograph.
Yes.
And I thought using the ultrasound would be easy. So I started working on it. We compare the ultrasound technique with plethysmograph, with intra-arterial pressure. We have a pretty good system going to collect all the data. Another person who really helped me a lot is John Hobbs. He is a senior lecturer He was in Brigham Hospital in Boston for 2 years. And he is the one that helped me to do all the blood flow study. So we accumulate a lot of data on Doppler, on exercise, and the professor thought that this work should be considered for PhD thesis. So I just go on, do all the work related to plethysmograph, ultrasound, electromagnetic flow meter, and the whole bit, and write a thesis on it.
Now, while the Doppler was being applied to vascular surgery by Strandis and Sumner, your research allowed the ankle-arm index ratio to be demonstrated, and I have to say that this simple test revolutionized non-invasive testing. And I think this is well recognized. There were many other people involved in non-invasive testing, but not with a simple test that provided so much information. When did Trevor Windsor fit into all of this?
Well, Trevor Windsor wrote a book, I don't know if you know that, on non-invasive, non-plethysmograph. Most of them are on the limb blood flow. He did mention about pressure index. He did mention about the lower limb pressure compared with the upper arm, and wrote about that, but really never applied clinically.
Right.
We did a lot of tests on patients with severe ischemia, collocation, and normal.
Right.
So we kind of know with a different level ankle pressure index reflect the clinical symptom. And this is a simple test. It can be done by anybody.
Right.
So I'm think, we need a simple test can be done by everybody instead of having too complicated tests.
Right. The plethysmograph was not so easy.
I actually corresponded with Gene Strandis and David Sumner on the lower limb blood pressure measurement. I learned a lot from Gene Strandis on that.
In 1971, you were able to return to the United States, and what happened there?
I went back to stay and work at Detroit Receiving Hospital. I was not really happy in Detroit because Receiving Hospital is, like Cook County Hospital, is a trauma hospital.
Not much vascular.
Not much vascular, nothing against trauma. Norman, it's just I'm just not a trauma type of surgeon. So I was not really happy in that institution.
Now, what got you and John Bergen together in 1972?
I went to Philadelphia for the vascular meeting, went to the cocktail party, met John Bergen, and all behold, he said, would you like to come back to Chicago? I was not very happy in Detroit, was really happy that somebody offered me a job in Chicago. So I said, sure, yes.
Now, I'd have to say that when you decided to join John Bergen at Northwestern, the rest is history. This resulted in a meteoric rise in your career. Suddenly, your practice was confined to vascular surgery.
John Bergen is the very first surgeon confined his practice purely from vascular surgery. He also did some transplantation then. Mm-hmm. When I was recruited, I was told to establish the laboratory and do vascular surgery only. So that's how I start.
So that suited you fine.
Yeah.
Now, also, you were able to use non-invasive testing to apply to routine vascular cases, which were certainly not the usual circumstances in the United States.
Well, we kind of try to use the non-invasive test for clinical use. So we talked to the hospital. We told them, you know, you have people do electrocardiogram. We can do all the Doppler tracing, pressure. We can do the same type of report. And we want to have referring physician, when they suspect a patient have vascular problem, they can go to the lab, get the test that can give them the idea whether the patient has artery disease. If they do, they can consult us. So the idea is to provide all the general internists a test that can make the diagnosis of vascular disease.
In 1974, you and John Bergen established a vascular fellowship at Northwestern, with the first fellow being Dick Dean. Tell us about the early days with the fellowship.
Dick Dean is our first fellow. I never treat Dick as a fellow. I was just in practice for a couple of years. I always treat him just like my partner. He come to my house in the morning. We go down to work together. I learned a lot from Dick Dean. Dick Dean is a wonderful surgeon. I learned how to do venous artery because he had done more than me. We never done a Warren shunt before, and he had done it. And I remember we just go take the movie by somebody on Warren shunt, and after that, and we go, and we did 50 cases after that, and then we wrote a paper.
And finally, about your career at Northwestern, you and Dr. Bergen initiated this fabulous symposium. This is your current symposium in book form. Jimmy, how did this happen?
This is all Bergen's idea. He feel in the end of the year, December is a good time to kind of reflect what happened in that year, so we have a meeting. And also, the first symposium was honor geyser detectors on venous problem. We have a wonderful meeting with all the surgeons from all over the world to come on venous. Once the venous problem getting so popular, we decide to continue to do it every year. And then 2 years after the venous problem published, the publishing technique using computer for typesetting coming in, so you can publish a book much quicker. You know, we had a venous problem in the symposium, and then it take us 2 years before the book in print. But with a rapid electronic typesetting, they can print the book much quicker.
How long did this one take?
This one we finished in a computer package, sent to China. The Chinese printing company printed, air freight back in a week. It's done. It's amazing. And we also lucky to have W.L. Gore give us a education grant so we can do the book every year. And Bergen is the one that started the idea of doing it.
Jimmy, let's talk for a moment about your career highlights. Besides and beyond the hundreds of operations with excellent results that you were involved in, multiple books, 57, I think in all, 58 now.
Yeah.
Hundreds of articles, over 300. There were multiple honors and highlights, just a few of which include being the SVS president in 1993, the SVS Lifetime Achievement Award in 2007, all of your non-invasive laboratory achievements, the Northwestern Symposium, which although Dr. Bergen was certainly a strong influence in that area, I would have to say that you probably did just as much in developing this as as a worldwide symposium, the Vascular Fellowship. At one point, you even got recognition from the city of Chicago and the mayor.
Well, mayor is a friend. It's very nice for him to designate one day in my name. So it's kind of fun.
Sounds like a lot of fun. Talk for
By
a
the
moment.
way, Gazer Detector got the same thing too.
Oh, did he?
Yeah, he did.
I didn't know that. Now, talk for a moment more on your position on critical analysis in vascular surgery and how the API represented an objective measurement to assess results, not only diagnostics pre-op, but to assess post-operative results.
Well, in the old day, you feel the pulse, it's not really reliable. What ABI offers is a very definitive, objective test to assess the result after bypass, after different type of reconstruction. It's a simple test. If the surgery is successful, the pressure got to be improved. And I think based on that, a lot of other people will work on the same area, like Gene Strainer, David Sumner, you can name it. Everybody know we need to have a objective test besides arteriogram.
Right. Also, you extended your interest further into basic science, specifically the molecular biology arena, to address the etiology of vascular disease. Why weren't you satisfied with just clinical work and non-invasive work?
Well, I think at that time in the 80s, to have a fellow to do research became very common at that time of the stage. So we decide, we should have the fellow also learn how molecular biology can affect the investigation of vascular problem. So we recruit Bill Pierce, who have a lot of interest in this area, to head up the program, to train the fellow to learn about molecular biology, especially in aneurysm. It happened the person in the medical school, Richard Chisholm, is a molecular biology. A wonderful guy. When we approached him, see we can work together, he took our fellow under his wing, teach them all the molecular biology technique. Our fellow worked with him most of the time on molecular biology research, and we have a good run of fellow that get very, very, very good exposure to molecular biology.
Terrific. Jimmy, let me ask you, why you, out of the hundreds of young surgeons trying to do vascular surgery in the young days of vascular surgery, why did you excel?
You get support from all the people surrounding you. I'm lucky to have a lot of good support from fellow, from residents, and from attending staff. And I think maybe somewhat lucky. And I think that in America, you had the chance to be recognized, to get better, to work hard, you get recognized. I think I won't get to where I am in London, and that won't be a case. That won't be happening in China. I mean, this is America. That's what can make you be something special, because America gave you the chance.
It's a very, very strong statement. And I'd have to say, I remain amazed at your story. The odds against you being successful were just enormous. here was this FMG with this strange accent. How could you possibly succeed? These odds were just enormous.
Again, this is America. You get the opportunity, you seize the opportunity, you work hard, you get recognized. And I get appointed to the presidency is due to all the American colleagues. They think I'm okay.
Well, you were certainly more than okay. Jimmy, in every human being's life, they've had to face failure. Did you ever have to face failure? And how did it affect you?
Well, the failure, most of my failures relate to patient care. Every now and then you did an operation, you think you had done everything or you should come out good, and then still, patients still have trouble. And that I've considered is a failure. That bothers me. Yeah, I go through all the motion, should do this and shouldn't do that. I think we all do have that failure in a sense that we have to really review the situation.
How did it affect you? How did you respond to that?
Well, respond to it, you cannot get depressed all the time. You just have to get up and do it again and try to do it better.
Right. In doing research for this interview, I've been impressed with how many people have told me about Jimmy Yao, the diplomat, and how that you had some secret for getting along with other people. How you modeled your group into being just a group of guys working together to being a close-knit group that was almost family. How did this happen?
Well, I treat them with respect. I don't really consider I'm anything up on them or anything better than them. I treat them like, my team. I would take care of them and I respect them. And I don't really, dress them down and something like that. And most of the people respond to that type of approach.
Did you ever think of going to Washington, D.C.? to try to straighten out the government there?
Not me. I'm not a politician.
And Jimmy, talk for a minute about the mentors that you have had and who, in your mind now, looking back, were important for you.
I think first I really like to say that many American residents that really my mentor about American life. They taught me how to drive a car, how to watch the football game, took me to baseball, get me into the American life. Sport is very important in American life, and I'm very lucky to have a lot of instruction from my fellow residents. I learned how to write paper from Dr. Shoemaker at Cook County Hospital. He's a researcher, and you should see the first manuscript. It was many cross and question mark, but I learned how to write paper from him. In London, I learned a lot from John Hobbs, and the Professor Irvine is the one that really made the difference in terms that he said you should do a PhD because that would help you when you go back to America. And from there, and at the hospital, I had a couple attending when I was in county. They were volunteer at county, and I know. And Jim Hine, the general surgeon in particular, that I get along very well, give me a lot of good advice, how to deal with patients, how to deal with people. Those are people that help me go along the way. So,
Jimmy, you mentioned your newfound enthusiasm for sports. And the fact is you operated on many famous athletes. Could you tell us about your interest in thoracic outlet syndrome and George Halas and Ron Santos and the number of prominent sports figures that came to you?
The team physician for Chicago Bear is in our hospital. Mr. Harris developed a femoral emboli. I think that's the best operation you can do because it's easy with great result. Under local, you take the thing out, fold it out, and pulse return. Patient feels wonderful. That's all I did to Mr. Harris.
What about thoracic outlet?
Thoracic outlet is interesting because the baseball player have the shoulder that they exercise, they throwing effort is so strong, so they do have artery damage. Again, the team physician for Chicago Cubs is in our hospital, so I get a chance to see a lot of baseball players. And from there, some other teams send their patient in. So we operate on, 7 or 8 or 9 professional players.
Now, Jimmy, I'd like to ask you for some opinion in several areas. The first being the direction of American medicine. You're in a unique position, having seen the Chinese system, you've seen the English model, and now you've been in the United States for some time. Now that medical care has become such a political football, do you think we're losing our way?
I don't know we are losing, but we are not gaining, that's for sure. I think that's too much fighting in between the Congress. There's too many personal agendas injected into the system. And I think that we are having too much trouble in terms of to get two parties work together.
Do you think medical care can be reformed?
I really don't know. I'm sure something needs to be done, and I have faith. I think America can fix it. Eventually, it will be done.
I hope so. Give us your thoughts, Jimmy, on why the effort to establish an independent board of vascular surgery failed.
Most people in the American Board of Surgery, from what I can understand, I talked to Dave Nawal, who was the chairman of the board and chairman of the medical specialists, and I can tell by talking to him, their idea is don't want to have too many boards. They want to be like the internal medicine, with one internal medical board and then a lot of sub-board underneath. I think the independent board really drive the American board to ease out their regulation. And I think as long as vascular surgeons are doing all the regulations, like training defined by the vascular surgeon, how many cases should be done by what should be decided by the vascular surgeon. So as long as we have the power to do all those things, I don't care whether it's under what board or what not.
What is your impression of endovascular surgery?
It's going to stay. It's a technology driven, and I think technology is going to get better. I think operation is reaching the maximum. Right now, everything at once are on technology. Then technology will get better.
What is your favorite operation?
I love cardiac artery surgery. It is a clean anatomical operation and yet have a great potential impact if you're not doing it right. So you are under a lot of stress to do it, but it's a great operation.
Yes. I know you feel strongly about this next question, and I'd like you to speak to this with some authority. And that is, there's seems to be a waning interest in international exchange. And through your terrific experience, how do you view international exchange, and do you think that the merger of SVS and the North American chapter of ISCVS has hindered this exchange?
I'm sure losing ISCVS did affect a little bit on international exchange. I've been, in the past couple years, been working hard to promote the international membership of the SVS. For instance, in June, in the annual meeting, we had 25 Chinese vascular surgeons come over. I have worked with a private foundation called Atria Foundation to develop a visiting scholar program to bring young vascular surgeons to this country. They spend a couple weeks with us at Northwestern and then go to University of Michigan or Harvard. And to me, those programs are very, very useful. We have 5 or 6 surgeons came through. We had a Russian came, which is she really enjoyed it. I think that's a good way to do exchange. And I am now helping the Chinese Vascular Society to develop the China chapter for SVS. I'm also working with Raymond Berger to get a Chinese edition for the annual vascular surgery. So those things I am working on and try to improve that. We try to target countries where vascular surgeons are still not quite recognized as a specialty.
Yes.
So we are trying to do that.
If young surgeons came to you that had been trained in vascular surgery for advice, what would you tell them?
I think we have a great future. The technology is going to get better. Things you're going to be fine. Just have to work hard and shut up and do it.
Jimmy, thank you for allowing this interview, and also thank you for the idea of starting this archive in vascular surgery.
Thank you for your interview. Thank you.
Dr. Yao is Emeritus Professor of Surgery, Feinberg School of Medicine of Northwestern University. He has served as Magerstad Professor of Surgery, Chair, Department of Surgery, and Chief, Division of Vascular Surgery. He is the founder of the Blood Flow Laboratory at Northwestern Memorial Hospital, Chicago, and was an attending vascular surgeon at Northwestern Memorial Hospital for 35 years. A graduate of National Taiwan University, he took general surgical training at Cook County Hospital in Chicago. Dr. Yao went to St. Mary's Hospital Medical School in London to further his training in vascular surgery under the aegis of Professor W.T. Irvine. At the same time, he received a PhD in vascular physiology from the University of London. His research interests have centered around peripheral vascular problems, including arterial and venous problems, and non-invasive diagnostic techniques. These investigations have formed the basis for the more than 500 contributions to the surgical literature listed in his bibliography. In addition, he is co-editor of more than 50 books on vascular surgery, including 2 texts on non-invasive vascular diagnosis and 1 on angiography of vascular disease. He also served as co-editor of the annual Yearbook of Vascular Surgery from 1986 to 1991. Dr. Yao has served as president of the Lifeline Foundation, Society for Vascular Surgery, the Midwest Vascular Surgical Society, the Chicago Surgical Society, and the American Venous Forum, as associate editor of Journal of Vascular Surgery and Journal of Endovascular Surgery, as editorial board member of Annals of Vascular Surgery, British Journal of Surgery, and as co-chief and later chief editor of Cardiovascular Surgery. Dr. Yao has been honored with the Society of Vascular Technology Pioneer Award, the Christian Fanger Award, Carl Meyer Surgical Society, Surgical Alumni Association of Cook County Hospital, and the Society for Vascular Surgery Lifetime Achievement Award, and the Pioneers in Performance Award. In 2015, Dr. Yao was awarded the René Lariche Prize by the International Society of Surgery. Dr. Yao has 2 daughters, 1 son, and 3 grandkids. He resides in Wilmette, Illinois with his wife, Louise.